let's take a closer look at the reservoir or source in the infection cycle. Remember, this is the second step in the cycle, coming right after microorganisms. The reservoir refers to the environment where a microorganism can survive, grow, and potentially multiply. It serves as the source from which the infection can spread. Understanding reservoirs is key to breaking the chain of infection and preventing disease transmission. The reservoir, or source, is the place where a microorganism resides. It's essentially the environment that provides the microorganism with what it needs to survive. Remember, microorganisms can't live long without a host or some type of food source to sustain them. One example of a reservoir, or source, is humans. When someone is sick, the microorganism uses their body as a host, taking advantage of their resources to survive and multiply. From there, the microorganism can spread to another person, continuing the cycle of infection. Other examples of reservoirs or sources include equipment used on patients, contaminated food, insects, water sources, and animals. Each of these can provide the necessary conditions for microorganisms to survive and potentially spread to humans, continuing the infection cycle. So, how can we stop microorganisms from surviving and being passed on to another person? The key lies in breaking the chain of infection. The most effective way to prevent microorganisms from living on you is hand washing. According to the CDC, regular and thorough hand washing is the best method to stop pathogens from residing on your skin and spreading to others. It's a simple but powerful step in breaking the chain of infection and maintaining good hygiene. Whenever possible, wash your hands with soap and water, as this is the most effective method. However, if soap and water aren't available and your hands are not visibly dirty, you can use a hand sanitizer with at least 60% alcohol content. This can help kill many microorganisms and prevent their spread. The proper steps for effective hand washing are as follows. 1. Turn on the faucet using a foot pedal if available, or with a paper towel on the handle to avoid contamination. 2. Wet your hands thoroughly and lather with plenty of soap. 3. Scrub all surfaces of your hands, including between your fingers, the backs of your hands, under your fingernails, and up to your wrists. 4. Wash for at least 20 seconds, the amount of time it takes to sing Happy Birthday twice. 5. Rinse your hands with your fingers pointing downward so the water flows from your wrists to your fingertips, carrying any debris down the sink. 6. Turn off the faucet by releasing the foot pedal or using a clean paper towel to avoid recontaminating your hands. 7. Dry your hands with a clean paper towel to ensure they are completely dry. Following these steps helps ensure your hands are free of microorganisms and ready to prevent the spread of infection. Another important way to prevent microorganisms from living on surfaces is through proper housekeeping. This involves cleaning and maintaining the environment to reduce the risk of infection. Start by disposing of any contaminated materials left in a patient's room in the appropriate receptacle. Next, wipe down all surfaces with an approved cleaner or disinfectant wipe. These chemicals are designed to kill any microorganisms that may be left behind. Replace table paper, sheets, and pillow covers between patients, and send reusable fabric items like gowns or blankets to be laundered. Finally, always change your gloves and gowns before moving on to care for a new patient. These steps are essential for maintaining a clean and safe environment for everyone.